Welcome to today's video about symptoms of painkiller overuse. What if the very medication you're taking to relieve your pain is actually creating more problems than it's solving? What started as a simple solution to manage discomfort could be slowly turning into a dangerous cycle that's damaging your body in ways you never imagined. Today, we're going to uncover the hidden warning signs that your painkiller use has crossed the line from helpful to harmful. Picture this. Millions of people worldwide reach for painkillers every day, trusting these medications to provide relief. But here's what most don't realize. These same medications can become silent saboteurs, wreaking havoc on multiple organ systems when used incorrectly. The signs are often subtle at first, easy to dismiss or attribute to other causes, but ignoring them could lead to life-threatening consequences. Now, let's go through the symptoms of painkiller overuse, beginning with the first one. Frequent headaches. Here's where things get truly alarming. The first symptom might shock you because it seems to contradict everything you know about painkillers. Research published in the International Classification of Headache Disorders reveals that taking painkillers too frequently can actually trigger what's called medication overuse headaches. This phenomenon affects patients who use simple analgesics like acetaminophen or NSAIDs for 15 or more days per month, or those taking opioids, triptans, or combination medications for 10 or more days monthly for over 3 months. Studies from major medical institutions show that this paradoxical effect occurs because chronic painkiller use leads to central sensitization in the brain's pain processing centers. The Journal of Headache and Pain reports that patients with medication overuse headaches often experience daily, persistent headaches that differ significantly from their original pain patterns. These rebound headaches create a vicious cycle where patients take more medication to combat the very headaches their medication is causing, leading to further escalation in both frequency and intensity of pain. The mechanism behind this is complex but crucial to understand. When painkillers are overused, they alter the brain's natural pain regulation systems. The National Center for Biotechnology Information explains that this leads to expansion of receptive pain fields, decreased pain thresholds, and compromised natural pain inhibition systems. What's particularly concerning is that research indicates NSAIDs may have a protective effect when used fewer than 10 days per month, but become problematic when usage exceeds this threshold. Next, number 2, stomach pain or ulcers. The second warning sign involves your stomach, and the statistics are genuinely frightening. Long-term NSAID use can systematically destroy your stomach's protective lining, leading to gastritis, ulcers, and potentially life-threatening bleeding. Research published in Gastroenterology Journal demonstrates that gastroduodenal ulcer rates range from 5 to 80% in short-term studies, with 15 to 40% of long-term NSAID users developing serious complications. The mechanism is devastatingly simple yet dangerous. NSAIDs inhibit cyclooxygenase 1 enzymes, which are responsible for producing protective prostaglandins in your stomach lining. Without these protective compounds, gastric acid begins to erode the stomach wall itself. Studies from the New England Journal of Medicine show that this damage can occur even with short-term use, and the risk increases linearly with both dose and duration of treatment. What makes this particularly insidious is that upper gastrointestinal bleeding often occurs without warning symptoms. Research indicates that up to 80% of patients who experience serious bleeding complications had no prior symptoms like epigastric pain or dyspepsia. A population-based study from Denmark involving over 160,000 patients found that even low doses of NSAIDs significantly increase the risk of upper gastrointestinal bleeding, with the effect being particularly pronounced in elderly patients and those taking concurrent medications like anticoagulants or corticosteroids. Next, number 3, nausea and vomiting. Moving deeper into the digestive system, the third symptom involves persistent nausea and vomiting that many people mistakenly attribute to other causes. This occurs through two distinct but equally concerning mechanisms, depending on the type of painkiller being overused. Opioid medications slow down the entire digestive process through their effects on the central nervous system, leading to delayed gastric emptying and prolonged intestinal transit times. Research from pain medicine specialists shows that opioid-induced nausea affects up to 60% of patients on chronic opioid therapy. The medications bind to opioid receptors in the chemoreceptor trigger zone of the brain, directly stimulating the vomiting center. Additionally, they slow gastrointestinal motility so significantly that food and medications can remain in the stomach for extended periods, leading to bacterial overgrowth and fermentation that triggers nausea. NSAIDs create nausea through a completely different but equally problematic pathway. These medications directly irritate the gastrointestinal mucosa while simultaneously reducing the production of protective prostaglandins. Studies published in Clinical Gastroenterology demonstrate that this dual action leads to inflammation of the stomach lining, which the body recognizes as a threat, triggering nausea as a protective response. The severity often correlates with the degree of mucosal damage, making persistent nausea a potentially serious warning sign. Next, number 4, constipation. The fourth symptom is one that patients often find embarrassing to discuss, but it's critically important to recognize. Chronic constipation, particularly when using opioid medications, can become so severe that it leads to bowel obstruction or perforation. Research shows that opioid-induced constipation affects between 40 and 95% of patients on chronic opioid therapy, making it one of the most predictable side effects of these medications. The mechanism involves opioid receptors throughout the gastrointestinal tract, not just in the brain. When these receptors are activated, they dramatically slow intestinal contractions, reduce digestive secretions, and increase anal sphincter tone. Studies from gastroenterology journals show that this can lead to stool becoming so hard and impacted that normal bowel movements become impossible without medical intervention. What makes this particularly dangerous is that the constipation often worsens progressively, and tolerance to this effect rarely develops, unlike tolerance to pain relief. Research indicates that patients may go days or even weeks without bowel movements, leading to toxic megacolon, bowel perforation, or severe electrolyte imbalances. The Journal of Pain Medicine reports cases where patients required emergency surgery due to complications from opioid-induced constipation, emphasizing how this seemingly minor symptom can become life-threatening. Next, number 5, liver damage. Now we reach perhaps the most terrifying symptom of all, liver damage from acetaminophen overuse. Here's a statistic that should make everyone pause. Acetaminophen overdose is the leading cause of acute liver failure in Western countries, responsible for approximately 45% of all acute liver failure cases in the United States. What makes this particularly insidious is that liver damage can occur even with doses that many people consider safe. The liver processes acetaminophen through specific enzyme pathways, primarily creating harmless metabolites that are easily eliminated. However, when acetaminophen intake exceeds the liver's processing capacity, a toxic metabolite called NAPQI begins to accumulate. Research published in hepatology journals shows that this toxic compound directly attacks liver cells, causing massive cellular death that can progress to complete liver failure within days. The FDA clearly states that severe liver damage may occur if you take more than 4,000 milligrams of acetaminophen in 24 hours. But studies reveal that even therapeutic doses can cause problems in certain individuals. Factors like alcohol consumption, fasting, and underlying liver disease can significantly lower the threshold for toxicity. Research indicates that people who consume alcohol regularly may experience liver damage with acetaminophen doses as low as 2,000 milligrams per day, well within what many consider normal usage ranges. Next, number 6. Kidney problems. The 6th symptom targets your kidneys, the body's crucial filtration system. High doses of non-steroidal anti-inflammatory drugs systematically reduce blood flow to the kidneys, potentially leading to chronic kidney disease that may require dialysis or transplantation. This occurs because non-steroidal anti-inflammatory drugs inhibit the production of prostaglandins that normally keep kidney blood vessels dilated and functioning properly. Research from nephrology journals demonstrates that this kidney damage can be particularly insidious because it often develops without obvious symptoms until significant damage has already occurred. Studies show that even short-term NSAID use can cause acute kidney injury, particularly in patients who are dehydrated, elderly, or have underlying health conditions. The damage occurs at the cellular level with inflammation and scarring, gradually reducing the kidney's ability to filter waste products from the blood. Population-based studies have found that chronic NSAID users have significantly higher rates of chronic kidney disease compared to non-users. The risk appears to be dose-dependent and duration-dependent, with research indicating that people who use NSAIDs regularly for more than 1 year face substantially increased risks of kidney failure. What's particularly concerning is that this damage may be irreversible, making early recognition and intervention crucial for preventing permanent disability. Next, number 7. Drowsiness and fatigue. The 7th symptom affects your mental clarity and energy levels in ways that can completely disrupt your daily life. Chronic drowsiness and fatigue, particularly from opioid overuse, result from these medications' effects on the central nervous system. Opioids don't just block pain signals. They depress multiple brain functions, including those responsible for alertness, cognitive processing, and energy regulation. Research from neuroscience journals shows that chronic opioid use leads to changes in brain structure and function that persist even when patients are not actively experiencing pain relief. The medications affect neurotransmitter systems responsible for motivation, reward processing, and executive function. Studies using brain imaging technology demonstrate that chronic opioid users show decreased activity in brain regions responsible for decision-making, attention, and energy regulation. This isn't just feeling tired after taking medication. This is a persistent state of cognitive impairment that affects work performance, driving safety, and quality of life. Research indicates that the fatigue associated with chronic opioid use can be so severe that patients score similarly to those with clinical depression on standardized fatigue assessments. The drowsiness also increases the risk of accidents, with studies showing that chronic opioid users have significantly higher rates of motor vehicle accidents and workplace injuries. Next, number 8. Mood changes and depression. The 8th symptom involves changes in mood and mental health that can devastate relationships and quality of life. Research consistently links long-term opioid use with significantly higher risks of anxiety, depression, and irritability. What makes this particularly tragic is that these mood changes often drive patients to seek even more pain medication, creating a downward spiral that becomes increasingly difficult to escape. Studies published in psychiatric journals show that chronic opioid use alters brain chemistry in ways that affect emotional regulation, stress response, and social behavior. The medications interfere with the brain's natural reward systems, leading to a condition where patients need opioids just to feel normal, not necessarily to control pain. Research indicates that up to 60% of patients on long-term opioid therapy develop clinically significant depression or anxiety disorders. The mechanism involves changes in neurotransmitter systems beyond just the opioid receptors. Chronic opioid use affects dopamine, serotonin, and norepinephrine systems that are crucial for mood regulation. Brain imaging studies show that these changes can persist for months or even years, after discontinuing opioid medications. The emotional symptoms often include increased irritability, social withdrawal, loss of interest in previously enjoyable activities, and feelings of hopelessness about the future. Next, number 9. Respiratory issues. The 9th symptom represents one of the most immediately dangerous effects of painkiller overuse: respiratory depression. Opioids don't just affect pain perception. They directly suppress the brain's respiratory control centers, slowing breathing to potentially fatal levels. This isn't just a concern with illegal opioids. Prescription medications like morphine, oxycodone, and fentanyl can all cause this life-threatening effect. Research from emergency medicine journals shows that respiratory depression can occur even with prescribed doses, particularly when combined with other medications like benzodiazepines or alcohol. The mechanism involves opioid receptors in the brainstem that control automatic breathing functions. When these receptors are overstimulated, they can essentially forget to signal the diaphragm to contract, leading to increasingly shallow and infrequent breaths. Studies indicate that respiratory depression often develops gradually, making it particularly dangerous because patients and their families may not recognize the warning signs until it's too late. The initial symptoms include slower breathing, longer pauses between breaths, and decreased oxygen saturation. Research shows that respiratory rates below 12 breaths per minute in adults indicate significant respiratory depression, and rates below 8 breaths per minute represent a medical emergency requiring immediate intervention. Next, number 10. Increased pain sensitivity. The 10th symptom represents one of the most counterintuitive effects of painkiller overuse, actually becoming more sensitive to pain despite taking pain medications. This phenomenon, known as opioid-induced hyperalgesia, occurs when chronic opioid exposure leads to neuroplastic changes that sensitize pain pathways rather than dulling them. Research shows this affects a significant percentage of patients on long-term opioid therapy. Studies from pain research centers demonstrate that opioid-induced hyperalgesia involves complex changes in spinal cord processing, neurotransmitter balance, and pain pathway sensitization. The medications that should be reducing pain actually increase the number and sensitivity of pain receptors, making patients more susceptible to pain from stimuli that wouldn't normally be painful. Brain imaging studies show altered pain processing patterns in patients with opioid-induced hyperalgesia compared to both healthy controls and patients with pain who aren't taking opioids. What makes this particularly insidious is that patients and healthcare providers often interpret increased pain as a sign that higher doses of opioids are needed, when in fact, the opposite is true. Research indicates that the only effective treatment for opioid-induced hyperalgesia is reducing or eliminating opioid medications, often requiring specialized medical supervision to manage withdrawal symptoms while allowing the pain processing systems to normalize. Next, number 11. Dependence and withdrawal. The final and perhaps most devastating symptom is the development of dependence and withdrawal symptoms when trying to stop or reduce painkiller use. This isn't about willpower or character. This is about fundamental changes in brain chemistry that occur with regular painkiller use. Research shows that physical dependence can develop within days to weeks of regular opioid use, even when medications are taken exactly as prescribed. The brain adapts to the presence of these medications by reducing its own production of natural pain-relieving compounds and altering neurotransmitter systems. When the medications are reduced or stopped, patients experience withdrawal symptoms that can include restlessness, sweating, insomnia, severe pain, nausea, and intense drug cravings. Studies indicate that these symptoms can be so severe that patients feel compelled to resume medication use just to feel normal. Research from addiction medicine specialists shows that withdrawal symptoms can persist for weeks or months, particularly the psychological symptoms like depression, anxiety, and sleep disturbances. Brain imaging studies demonstrate that it can take 6 months to 2 years for brain chemistry to fully normalize after discontinuing chronic opioid therapy. This extended recovery period helps explain why so many people find it difficult to stop painkiller use, even when they recognize it's causing problems. What makes this particularly tragic is that the symptoms patients experience during withdrawal are often interpreted as evidence that they need the medication, when in fact, these symptoms are evidence of the medication's harmful effects on brain function. Studies show that with proper medical supervision and support, patients can successfully discontinue problematic painkiller use and often experience significant improvements in both pain management and overall quality of life. The reality is that painkiller overuse represents a complex medical problem that affects millions of people worldwide. Research consistently shows that early recognition of these warning signs, combined with appropriate medical intervention, can prevent many of the most serious complications. The key is understanding that these symptoms represent your body's attempt to warn you about medication-related harm, not necessarily signs that you need more medication. If you're experiencing any of these symptoms, particularly multiple symptoms simultaneously, it's crucial to work with healthcare providers who understand the complexities of medication overuse. Studies show that with proper support, patients can successfully transition to safer pain management strategies that provide better long-term outcomes without the risks associated with chronic painkiller overuse. Remember, recognizing these symptoms isn't about judgment or blame. It's about protecting your health and preventing potentially irreversible complications. The research is clear. Early intervention and appropriate treatment can help people regain control over their pain management while avoiding the devastating consequences of continued painkiller overuse. If this video was helpful, kindly type "helpful" in the comments below. That motivates us to continue producing more content like this. Your engagement helps us reach more people who might benefit from this crucial health information. Please don't forget to like this video if it provided valuable insights, share it with anyone who might benefit from understanding these warning signs, and subscribe to our channel for more evidence-based health content. Thank you for watching, and remember, your health is worth protecting, and seeking help is always a sign of strength, not weakness.